Thank you for allowing me the opportunity to present this phase 1 expansion study of P-cadherin-targeted therapy with Y90-FF-21101 antibody in advanced chemorefractory colorectal and pancreatic-biliary cancers. Again, what is cadherin? Cadherin are cell surface glycoproteins that mediate calcium-dependent cell-cell adhesion required for the formation of solid tissue. Several cadherins, including the placental cadherin, which is a P-cadherin, are overexpressed in many types, correlating with increased tumor cell motility and invasiveness. P-cadherin is of particular importance here because clinically, this is high expressed in multiple tumor types, whereas it is only minimally expressed in normal tissue, making it an attractive target. Again, promising activity was previously reported in multiple preclinical models. And in fact, we designed a first-in-human phase 1 study that was previously published in 2020 in Clinical Cancer Research on this phase 1 dose escalation study. The favorable safety profile and the initial anti-tumor activity for this P-cadherin radioimmunoconjugate warranted further evaluation of this radioimmunotherapy approach and provided the initial clinical data for supporting this expansion cohort supporting P-cadherin in pancreatic cancer and colorectal adenocarcinoma. And this was an expansion study at a flat dose of the recommended phase 2 dose from the phase 1 study of 25 millicurie per meter squared in patients with advanced gastrointestinal tumors. Disease assessments were based on a response evaluation criterion solid tumors, RECIST version 1.1. And the initial phase 1 part consisted of a standard 3+3 design, whereas the expansion part in advanced colorectal cancer and pancreatic and biliary cancers, including duodenal cancer, consisted of 18 patients in colorectal cancer and 13 patients with pancreatic cancer. And patients received repeated doses every 12 weeks until disease progression or unacceptable toxicity. So the major inclusion criteria was histology confirmed colorectal cancer patients or pancreatic carcinoma patients or cholangiocarcinoma patients with documented disease progression following previous therapy and with adequate hematologic parameters, renal and hepatic function. So 31 total patients were treated, and most of the patients were heavily pre-treated. The median age was 63, 18 patients with colorectal, 13 patients with pancreatic or biliary, 8 patients with pancreas, and most of the patients had an ECOG performance status of 1. Patients received a median of 1 dose of this drug. 3 of 31 patients received 2 doses, which is administered 12 weeks apart, and there was dose reduction to 20 millicurie was required in 3 patients. There was 1 serious adverse event of intracranial bleed related to cerebral metastasis with contributing study drug-associated thrombocytopenia. Evidence of activity. The median duration on study was 8.1 weeks in colorectal cancer patients and 8 weeks in pancreatic biliary cancer patients. The median progression-free survival and overall survival was 8.3 and 27 weeks, and 7.9 and 17.1 weeks in the colorectal cancer cohort and the non-colorectal cancer cohort, respectively. The clinical benefit rate in colorectal cancer patients based on best overall response of stable disease was 43.8%, 7 out of 16 patients, and long-term disease control was achieved in several heavily pre-treated patients. 2 patients with pancreatic cancer maintained stable disease for greater than 15 weeks following initial repeat doses at 3 months. Both had 2 prior gemcitabine and 5 FU-containing treatment regimens. In addition, a 65-year-old male received 2 doses 3 months apart and maintained a stable disease for greater than 25 weeks. Prior therapy for this patient consisted of FOLFIRI plus bevacizumab, FOLFOX plus bevacizumab, trifluridine, tipiracil, BBI, TLR7, and a stem cell inhibitor. As you can see, these patients are heavily pre-treated, and in these patients, the agent showed clinical benefit. And again, the pharmacokinetics also was similar to the phase 1 part. So in summary, what we showed was this radiopharmaceutical conjugate in the expansion cohort was generally well tolerated, and we saw an acceptable and a predictable safety profile from the first in human cohort. The clinical activity was seen in heavily pretreated patients with advanced colorectal and pancreatic-biliary cancers. Stable disease was observed in 4 patients with colorectal cancer for a range of 15 to 27 weeks. And 2 additional patients with pancreatic cancer continued radiopharmaceutical of P-cadherin treatment with stable disease for greater than 15 weeks. So what is the take-home message? This novel first-in-class radiopharmaceutical conjugate, a Y90 conjugated FF-21101 P-cadherin radiopharmaceutical administered every 12 weeks demonstrated expected toxicities, preliminary evidence of benefit in heavily pretreated patients with advanced colorectal cancer. The optimal dose and schedule for this radioimmunotherapeutic will continue to be explored along with pre-treatment P-cadherin expression as a predictive biomarker for disease response. The current study is still ongoing in patients with pancreatic-biliary cancers. Thank you so much for the opportunity.